It is my pleasure to present our work at this conference. I'm a computer scientist from South Korea. Korea, being one of the first countries affected by COVID-19, we were in a unique position to observe the birth and spread of many misinformation rumors. Here are some of the popular rumors that you have seen about COVID-19. Drinking alcohol can kill the virus in the body, or eating garlic ginger can help prevent the infection. You can find these rumors in virtually every language possible. What was surprising to us for researchers in Korea was that a lot of these rumors, when they propagated in many countries, had already been fact-checked and nobody would believe them in South Korea and China. There were some rumors that only spread locally. For example, fireworks can kill the virus in the air, or eating 9 eggs a day can prevent the infection. Not many countries have seen these rumors. Existing research has shown mechanisms of rumor spreading. For any rumor to spread widely, it needs to have the audience who will buy into that information. So this means countries where there are nearly 0 patients or very few patients were less likely to be involved in a lot of the rumor spreading. This also means that algorithms can help social listening functions and help spot rumors at a much earlier rate when we look at the time-space correlation across multiple countries. Another research has shown that when false information is fact-checked and when it is flagged, people are less likely to propagate that. So the picture here shows propagation tree of a Facebook single post, and red dots appear when somebody writes on the comment, this information had been fact-checked and it is false. You see less tendency for that spreading to happen after the red dot. Yet we do know repeated flagging is so critical because many people simply do not know whether this information had been fact-checked before. So taking insights from previous research, we came up with the idea that maybe it might be useful to find already fact-checked information from one country and translate and propagate that to another country. During March of 2020, when COVID-19 was really at the early stage, we teamed up with scientists and other researchers from South Korea and United States and launched a joint campaign called Facts Before Rumors. Our goal was really simple. We wanted to collect fact-checked information, fact-checked by the local CDCs in China and South Korea, because we already had so many different rumors by the time, and translate them into as many languages as possible, create easy to understand, beautiful infographic, and spread them before rumors even start to propagate in many other countries. Our campaign was received well. The infographic of the 10 fact checks had been translated into 20 languages, all by 50 volunteers whom we found on the internet and spread through Facebook, emails, Twitter into 151 countries, reaching 50,000 shares. Now I'd like to share some of the findings from this very campaign. The first finding is about the prevalence of infodemics across countries. Our campaign was showing rumors along with fact checks and asked participants if they had seen the rumor before. This is how we are able to know rumor exposure rate of each country. And this bar chart here shows we see a higher rate of people who said they have seen any of these rumors in developing countries in the left-hand side compared to the developed countries in the right-hand side. This means that the very countries that are in greater need of the resources and infrastructure to combat the virus were being affected more in terms of exposure to infodemic. Our second finding is that when we examine the specific rumors, we found globally common patterns. Some rumors were really globally popular. The ones that we found were warmer weather will kill or weaken the virus spreading. Existing drugs can be repurposed to cure COVID-19. Yet some rumors did not have much say or standing in some of the other cultures. For example, the rumor about gargling can help the virus, kill the virus, spread more widely among the Asian countries. But the gargling rumor was not as popular in some other cultures. 5G rumor was the most popular among African countries and some of the European countries. Yet the 5G rumor was not so popular and people were not willing to spread it in Asian countries. So it seems like there's a lot of cultural preference for what kinds of rumors might spread better. Yet the 5G rumor, which was spreading really widely in some countries, had lowest believability rate. So that means simple exposure does not mean people are actually believing it. Our survey led to confirm that prior exposure to vaccines or having seen the fact checks or thinking COVID-19 is real were positively correlated with willingness to vaccinate. The most striking finding of our study was that having seen the false information and starting to believe it had the highest negative correlation to vaccination. So here are some takeaways. First, high exposure to misinformation does not necessarily mean people are believing them. So maybe what to fact check first can take into account these facts. Second, belief in false information seems correlated with vaccine hesitancy, and this means urgent actions are needed before any belief in misinformation sets in. Finally, detecting false news is not enough. Some preemptive measures, like what we have tried here, sending facts before rumors start to emerge, can be helpful. Thank you very much. I look forward to receiving your feedback.